Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the pharmacology of the carbamazepine. The carbamazepine is a primary anti-epileptic drug. It decreases the propagation of abnormal impulses in the brain. It blocks the sodium channel and inhibits the generation of repetitive action potentials in the epileptic focus. An epileptic focus may be a scar tissue in the brain. Therapeutic uses of carbamazepine: simple and complex partial seizures, tonic-clonic seizures, trigeminal neuralgia, and glossopharyngeal neuralgia, and other pain syndromes. Bipolar, that is manic depressive disorder, and Tourette syndrome. Okay, so it is an anti-epileptic drug. It is also used to manage pain, the excruciating pain along the distribution of the trigeminal nerve, specifically the maxillary nerve, maybe the mandibular division of the trigeminal nerve. So also glossopharyngeal neuralgia, bipolar disorder. People have sometimes mania in particular months of the year, followed by some months people has major depressive illness. So mania followed by depression, depression followed by mania is a feature of bipolar disorder. And one of the medication of bipolar disorder is carbamazepine. How it works in bipolar disorder, the mechanism of action in bipolar disorder is not known. Carbamazepine is also useful in Tourette syndrome. It is a behavioral problem. Person have tics, and even the boys in the school make some noise. They always make some sound noise by their throat. Even they make some animal noise. Tourette syndrome along with tics. The best drug is the haloperidol, but carbamazepine has some role also in Tourette syndrome. Absorption and fate of carbamazepine. Carbamazepine is absorbed from the small intestine. It is lipid soluble and reaches the brain because it can cross the blood-brain barrier. Blood-brain barrier is the structure formed by the tight junction between the endothelium of the blood vessel, and it is supported by the food process of the astrocyte in the central nervous system in the brain. It induces hepatic cytochrome 450 system activity and increases the metabolism of many drugs, including other anti-epileptic drugs. The plasma half-life of carbamazepine is 12 to 18 hours. Adverse effects: nausea, vomiting because it may irritate the gastrointestinal system, ataxia, person may have hard time to walk smoothly, diplopia, that is double vision, hyponatremia, loss of sodium, drowsiness, so there will be low level of sodium in the blood, drowsiness, blurred vision, vertigo, headache, erythematous rash, even dermatitis. Some book also say Steven Johnson syndrome, aplastic anemia, leukopenia, agranulocytosis, hepatotoxicity, liver damage, and there is potential to have congenital birth defect. It is a potential teratogenic agent, carbamazepine. So its use in pregnancy should be restricted, or monitored very regularly, supported by the vitamins, specifically folic acid. So drug interaction of carbamazepine, the hepatic metabolism of carbamazepine is inhibited by many drugs. So if we use those drugs along with carbamazepine, then the carbamazepine level will be in the blood will be high, and that may be toxic. So toxic symptoms of carbamazepine may arise if the dose is not adjusted. The following drug inhibit the metabolism of carbamazepine, and the blood concentration of carbamazepine will be increased. This is the cimetidine. This is an H2 blocker. It's an anti-peptic ulcer drug. Dicumarol, that is an anti-blood clotting drug. Okay. Diltiazem, that is a drug used in heart disease, also in hypertension. Erythromycin, antibiotic. Isoniazid, that is an anti-TB drug. Propoxyphene, that is an opioid agonist. Okay, so these all drugs may inhibit the metabolism of carbamazepine and increases the level of carbamazepine in the blood, that may lead to toxicity of carbamazepine. Other type of drug interaction, induction of macrosomal enzyme increases the hepatic clearance of the following drug like phenytoin, valproic acid, clonazepam, primidone. These all are anti-epileptic drugs. So those would be cleared by the liver very quickly because of the interaction of any of these drugs with carbamazepine. Okay, we have another drug, oxcarbazepine. Oxcarbazepine is a derivative of carbamazepine. This is an anticonvulsant drug and blocks the sodium channel and inhibits the propagation of abnormal discharges, impulse discharges like that of carbamazepine. Similar mechanism of action, but this drug is less potent and it has less toxicity. Its anticonvulsant spectrum and toxicity is like carbamazepine, but it is less potent. Oxcarbazepine does not cause bone marrow depression and liver failure. It may cause very rarely, but usually does not cause bone marrow depression, no agranulocytosis, no leukopenia, no anemia, okay, and no liver failure. But these are the common problem in carbamazepine. It has less potent liver enzyme inducing capacity and in comparison to carbamazepine, and its half-life is much less, 1 to 2 hours. Okay, and in case of carbamazepine, that may be 10 to 12 hours. Here it is 1 to 2 hours. Oxcarbazepine may decrease the effectiveness of oral contraceptive pill. Although this is a drug does not cause bone marrow depression, liver failure, but oxcarbazepine may decrease the effectiveness of oral contraceptive pill. Okay, and that's all about the pharmacology with carbamazepine and oxcarbazepine. Okay, and if you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.